Hello, everyone. A beautiful Sunday morning to you all. Welcome back to episode 90 of Instagram Live Guest Talk with Homeopathy Heals. So, today we are having a very fresh face, new artist today with us. She's young, she's dynamic, she's passionate, although very lesser known yet, but soon a shining star as a stalwart in homeopathy. Let's join. A very good morning to you, ma'am.
Good morning, good morning. How are you?
I'm so good. So, before we start our session, I would like to introduce the guest of honor of the week. She is none other than Dr. Aayushi Kania, and she practices in Surat, Gujarat since 2016. She's an experienced homeopathic consultant. She's a clinical psychologist, and she treats various range of diseases, acute and chronic. But she's been expert in infertility, skin diseases, autoimmune diseases, kidney disorders, autism, ADHD, and she provides treatment all across the globe, internationally and pan India. Again, a very warm welcome to you, ma'am.
Thank you so much for such a warm welcome. And I have
So,
always been following your page. I find you very gracious and so much passionate about it's so good to see you in such a stage and such widespread knowledge you have, and you're trying to give it to back to the community. That is more important.
yeah, ma'am, because I have listened or learned it that knowledge ना प्रसाद के जैसे ही बंटनी चाहिए, थोड़ा 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 सबका हक
True,
होना चाहिए,
true.
सबका हक होना चाहिए. तो शुरू करते हैं आज का सेशन
Sure.
विद ऑल ड्यू रिस्पेक्ट. तो ये क्वेश्चन मैं सभी गेस्ट से पूछती हूँ. सो माय सेम क्वेश्चन गोज टू यू एज वेल. व्हाई वी हैव सिलेक्टेड दिस टॉपिक टुडे?
Okay, so what happens at times, we begin something with not much focus or not a particular intention we have, but sometimes destiny has its plan, and then we fall into a category where we see that we are more passionate about this thing, or we are receiving good results in this particular area more. And it happens also so that you get such cases more frequently, right? So I have observed a lot number of cases wherein I am able to give back to the community or the people with homeopathy, and that is why this particular topic I would like to discuss, that we would like to share it to other people as well, that homeopathy does has a lot to give in this particular area. People usually do not prefer in this topic or this particular disease, or I would say a condition, not disease, to come at the first place to a homeopath. Okay, we always get such patients wherein they have gone to various other places, and the last resort comes homeopathy. Okay, at such point it becomes very difficult for a homeopath. You can understand that we have to find out, we have to pave the way, and then there's less time, there are so much challenges going on at the same time. So
Some people are asking about the today's topic. Today we'll be discussing about homeopathic approach in male and female infertility. So my next question, ma'am, to you is, what is the most challenging area to treat infertility, and why you choose infertility in practice?
okay, so I'll answer the second question first, right? So I learned from Baroda from one of my sir. He's very renowned there, and I've seen cases over there. He's been practicing with infertility, and I have seen and learned a lot from him. Not just infertility, a lot many things in a way. But happened so when I started my practice, I also landed up in the same field. Okay, so it was just likewise I told you that unintentionally But sometimes it happens that when such cases comes to you, you give miraculous results. It's not because of me, definitely. It's because of the one. But it's like you're destined to be on over here. And since childhood, I had a lot of faith in homeopathy. So luckily, my parents, they were just taking homeopathy when I was kid, and they were aware at that time also. And fortunately, I have never taken any kind of antibiotics. There hasn't been any instances that I had to take one. Okay. So since childhood, I was very much into homeopathy, and it happened so that I landed up here, and we just explored and explored into this.
Okay. Ma'am, what difficulties we face as a homeopaths when it comes to big shot gynecologist or infertility specialist, the setups for IUI and IVF which are available in the market. What difficulties you think as a homeopath we face?
So this is the most difficult area to begin with actually. First of all, patient will never come to you. If you tell someone with primary infertility that you go to a homeopathic doctor and they will help you, they'll say how. The first question is how. Okay. So the thing is that the patient should come to you to know that it has its potential. They should be aware. There is no awareness. I would not like to, we would put it other way, that anytime, whenever you see even a local doctor or any kind of a family doctor, if patient approaches them with infertility, they would directly refer it to an gynec. And if the gynec is unable to treat it for 2 to 3 months, nowadays it's a scene that they will go to IVF, right? So the process goes and goes and goes on. Now, once the patient comes to me, then things would go ahead, first of all. So the first challenge is this, that the patient should understand, there should be an awareness that infertility is completely curable, treatable, manageable, and everything related to pregnancy, everything is manageable very nicely with homeopathy. Okay. Both the sides, males as well as females. Second challenge is this, that when they come with a particular mindset, okay, some or the other doctor have told them you have to take donor eggs, you have to do surgery, you have to do laparoscopy, you have to hydrotubate your tubes, something like that. Okay, until and unless you won't conceive. But the fear of surgery will bring them to a homeopath. Okay, then no, I don't want to go for the surgery. They are not having faith in the system. Okay, there's a difference here. So I don't want to go to the surgery, but can you help me here? Can you unblock my tubes? They are again not asking for the pregnancy or the kid. Okay, can you unblock my tube? Can you break down my cyst? Without surgery, can you melt down my fibroid? So I have been told that I have to take donor eggs. Can you increase my count? That's it. I'll go again back to the IVF. So they point blank tell us this way. So the first thing when you encounter a infertility couple or a patient, the first thing is that they have to be totally into you. They have to trust the system. So you have to make that efforts from the first. Unlike the other patients we see, they are like, हाँ, मेरे को यही करना है. So they are not like that. So they will just inquire you. They will try and examine you, how much you know, because they come with a very particular mindset, and we have to work onto that from the beginning, from the base. That yes, we can do it, and this is how we will be able to do it.
Okay, so as I introduced, we all very well know that you are a clinical psychologist too. So, what role we play as a clinical psychologist through consultation? I mean, I want to know the importance of counseling and addressing the true problem.
See, it is extremely important. Okay. What happens basically when a couple comes with infertility, or a patient, female, male, either of them, they are extremely hopeless. Okay. Over a period of time, they have resorted to one doctor, another doctor, taken multiple treatments. And when they come to you, they are like, either you give me results now, or I am not able to continue treatment. Okay. The first question they will ask you is, how long will you able to give me the results? And the only results you are able to deliver in infertile couple is a pregnancy. nothing else will show that your system works. Okay, your reports may improve, but ultimately what? Right. So, what happens here is this that we have to talk with the patient, make them calm that okay, we are working, this is way we are going to work. We have to make them explain, first of all, these are the issues that you are tackling with. You have to come in terms with the practical knowledge, your applied knowledge, your clinical knowledge. We cannot tell them, oh, we are going to harmonize your vital force. No, that's not how they understand, right? We have to explain that we'll be working on your egg quality, right? This is how the system works. We will be giving you medicines, we will be making you this, that, etc. Still, age and time are the very big factors which run. Okay. If I tell my patient that you have to give some time, you have to give this much of time, sometimes they are not ready to give that much of time. Either they will ask you for 100% guarantee, which we obviously as a doctors no one can give, right? Right. So first of all, you have to make them understand that give some time to us. Talk to them, make them aware that 180 days is the minimum time your body will require to work on any kind of change we want. Okay. You you talk and find out what are the problems with your patient, right? There has to be a cause. Until and unless there's either it is on the mental level or on the physical level, there is a cause. Explain them, make them aware. This is the things that homeopaths can only do. Most of the time, other doctors, or we can say conventional doctors, they don't take out time and explain the patient that these are the issues they are tackling and this is the reason the result is not coming. They are on and on with the same medicine, hormonal cycles for months and months, right? So we make them explain that what is the importance of natural conception, why it is very necessary for your child, your genetics, and yourself, your own body. So this way, we have to counsel them, we have to talk to them, and we have to make them understand that we will be requiring time. This is the first step. Okay. The second area comes here is this that what I do usually, because I'm a clinical psychologist, I'm able to find out what are the borderline depressive traits and what are a healthy, I would say, healthy mental aspects, right? So it is a compulsion with me that I will be giving a BDI test. It is a very handy, friendly depression test. It just tries and find out if you are clinically depressed or not. So I try to give those questionnaires. It's a very basic questionnaire. Okay, a person can fill it itself, or even if you ask, there are 4 options for a question. And for example, like, are you eating more than before? Has your desires increase, decrease, or as it is? Are you more moody? Do you feel crying a lot nowadays? So this test helps me differentiate a lot in between, we would say, the treatments they have taken. So their symptoms, the hormonal treatments that they have been on since long. So it helps me differentiate here again. Most of the time, to my surprise, I find out that females with dealing with infertility are mild to moderately clinically depressed also because of this issue.
That's very
So
true.
even if they don't really realize it or they are not aware about it, at least it helps us to build up a case to prescribe to come to a medicine that we want.
Ma'am, can you please throw some light on tough patient compliance and how do you deal with it?
So likewise, I told you that some of the patients they don't come with that mindset that okay, we are ready to give some of the time, etc. Right? I have to work a lot with them. Okay. I give them freedom. First of all, if the patient is not ready, I give them freedom. What do you want to do? Are you ready to begin with the treatment or you're not? Okay. What are the issues that you are thinking? What are the thoughts that you have that you cannot go ahead? Or what are the things that are bothering you to continue? So, number one is that they will first of all ask me, can I continue allopathic and homeopathic medicines together? Right. Now, this becomes a very, very difficult thing to manage because it is something they are emotionally a lot of bottled up, right? Because they cannot, they, they, they only feel that only those medicines are going to work, but this is a supportive therapy which I can take. Okay. So I have to make them understand, give me some time, let us work, you will feel the difference. Okay. So many times when I tell patients that both of you need the medicines, either of them don't agree. Okay. So these are another challenging areas that I have to deal with. There are so many blockages, mental blockages. There are so many um, so sorry. There's so many. Am I audible? There are so many rigidities. There are so many. Again, I would say thought process that we have to break and build and break and build and work with them over a period of time. So it becomes very, very challenging and draining at the same time. And at the same time, you also have to look the whole process as the homeopathic case and to be unprejudiced and prescribed. So that way it becomes very difficult. There are social difficulties with such couples. They don't want people to know. They don't want donors. They don't want this. They don't want that. They are, sometimes I meet patients, they don't even want to tell the same like wife or the husband that they have this issue. They want to keep it a secret. Um, like, for example, one time I was struggling a lot with one patient, and after so many months, I found out that she's stuck at some point. What was that point? That she still stays in a rented house. And if the baby comes, how will I manage? I still don't have my own house. Right? So I found this took me so long to find out that that is the blockage she is having. All the things would come good, reports are improving, etc. But what about this? And immediately when you prescribe onto this, you see the results. Right. So at times it becomes very difficult to find out the cause, to work and to see where the patient is standing, to classify the patient, that which, where, how, and how to manage this patient. Every case is subjective, like you also might be knowing that, right? So there are cases where female wants to do homeopathy, but the male does not want to do. They are not, the partner is not ready. कि नहीं 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 चलो 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 1 मंथ होगा क्या हुआ कुछ तो हुआ नहीं आप ऐसे कैसे क्या हो क्या रहा है कैसे पता कैसे चलेगा कि ये दवाई काम कर रही है
So, uh, to add on this, I have few inputs. In
yeah
my practice, I have seen newly married couples for like 3 months, 4 months, just because they have a lot of family pressure. And even though having a faith in homeopathy, if they come to me and I ask them that at least you should wait for your first wedding anniversary and then you see a doctor, they either they change a doctor or they rush to a infertility center. This I have seen in my practice. So I would request all the patient, the viewers, those who are watching this, or if they are going to propagate this, that infertility is a condition when a couple is trying to conceive and they are not able to conceive over a period of 12 months of unprotected intercourse. So if it's still not 1 year, it cannot be called as infertility. It should not be named as infertility. And the basic difference between primary and secondary infertility is the primary infertility couples, they have never conceived, and secondary infertility couples, they have previously they have one or more kids and they want more kids and they are not able to conceive. So I have seen people, having so much rush to have kids. Could be possibly a family pressure. I mean, a family does not understand this, that they cannot have kids, you know, with the marriage, or if they have kids with the marriage, they'll they'll have a question of illegitimate child there also, even if couples have kid from the time of their marriage, because eventually it is society and relatives. They have to raise a question. They have to point out something. So if your doctor, or if your fertility specialist, or if your gynecologist says that you have to try naturally for more 6 and 8 months, so listen to them. Do not force your physician to start vigorous treatment, medicines, or investigations on you. Listen to your doctor. This is my request to all couples fighting with infertility. Okay, moving to next question. What difference does it make in dealing with primary infertility and cases which required surgical interventions?
All right, so as you say, that primary infertility is something that the patient is trying for the first time. They don't have kids, any kids, or even any kind of miscarriages previously, right? So these are fresh cases. Most of the cases we get are of primary infertility. Right? So, okay, the question was the difficulties you see with primary
Yeah, and
infertility.
cases requiring surgical interventions. The
Okay,
difference in dealing with, yeah.
yeah. So these are fresh cases. But the first time when the primary infertile couple comes to you, most of the time, 99% of them have done all the reports and then they are coming to you. Okay. They will bring this big files from various doctors, and if you say, अच्छा इसको साइड पे रखो, हम बात करते हैं, they will not have trust on you. Likewise, you told they don't want, because they are trained in a way with other various doctors कि पहले फाइल देखो, उसके बाद ही आगे बात करेंगे. तो शांति से उनकी फाइल्स देखिए, क्या क्या उन्होंने करवाया है, क्या दवाइयां ली है, उससे भी आपको बहुत सारी चीजें पता चलती है. ठीक है, तो अच्छे से उनकी फाइल्स देखिए. आई आस्क देम दैट यू प्लीज अरेंज इट फॉर मी फ्रॉम द ओल्डेस्ट टू द न्यूएस्ट. ओके, so that way we have one timeline in our head कि अच्छा पहले ये हुआ, उसके बाद ये हुआ, ये हुआ, ये हुआ. What are the basic things as a homeopath we should look when it is a primary infertility? I will be talking on the clinical aspect first. Okay. If they are now trying for a natural conception, please look that the tubes are open. It is a very basic requirement. Okay. If they have already done the tubal test, right, it is an add-on benefit to you that you know whether they are open or blocked. Most of the times, gynecologists will give rounds and rounds of hormonal medicines wherein the female does not even have a history of irregular menstruation or any kind of disturbance with menstruation, but will not check the tubal aspect. Right? वो पॉसिबल ही नहीं है फिजिकली. अगर आपकी ट्यूब्स ब्लॉक है तो आपका एग वहां से ट्रांसफर नहीं हो सकता है, ना ही जो स्पर्मेटोजोआ है वो रीच कर सकता है. तो आपको पता चल जाएगा कि हमको यहाँ पर काम करना है. ओके, हाफ ऑफ योर ट्रबल, आई वुड से मेहनत होम्योपैथी को लेकर यहाँ पे आधी हो जाएगी आपकी. ठीक है, आपको पता चल जाएगा. दूसरी चीज जो nowadays we see is this, that low AMH. Okay, it is very common, very frequent, and is being detected very early nowadays with female. Okay, even girls with 27, 26 years of age has AMH very low. I will just try and explain what is AMH. Okay, so first of all, AMH is an anti-Mullerian hormone. It is secreted from our ovaries by mature eggs. Okay, the eggs which has the capacity to turn into dominant follicle, right? If this hormone is low, gynecologists or the IVF specialists would directly point blank tell your patient to take a donor egg, right? They will try to trigger it with HCGs, etc., etc., but they don't have anything else to do. This is our forte. This is where homeopathy can help miraculously to the patient. Always remember. Okay? So these are the cases wherein they are told only कि नहीं होगा. They are expecting from you what good or what other things you can do. Okay? This is the case of primary. Second, surgical intervention when you tell me. So nowadays we see a lot of cases with endometriotic cyst or chocolate cysts. These are huge cysts. These are not simple follicular cyst. It's a huge cyst. Okay, thick walled. They don't rupture easily like if you give medicines, etc. They can range up to 5 centimeter to 10 centimeter also in a female, and she can still be asymptomatic. No problem. I mean to say, no trouble. Only when she goes into a scan, she comes to know that this is. So doctors they tell them you have to compulsory do a laparoscopy. So compulsory you have to do a surgery. Fibroids. Okay. A lot of fibroids in young females. And when there are a lot of fibroids, you see the position and the area where the fibroid is. Extremely important. If the fibroid is on the outer layer of the uterus, it will not hamper natural conceiving. Okay. If it is also in the middle layer and the size is small, it will not hamper with your conception, neither with carrying on with your baby. Until and unless it is in the area of your fundus and inside like the inner endometrial lining, then only you have to look into as a concern. Size matters, type matters, everything matters, even the quantity matters, right? Above that, as a homeopath, you should think that why this lady at this young age has so many fibroids. Okay, check the hormonal panels. You will see somewhere or the other way either she is estrogen dominant or she is prolactin dominant. Try to rectify the hormonal panel with the homeopathic case taking and the prescription. It will have an effect, definitely. Right. So this way, when you make explain your patient that yes, there is capacity that we can unblock your tubes. It can get unblocked at any given point. Okay, we can work, but this is an average time that we are going to take. Number one, it is going to take this much of time without surgery. We can work with fibroids as well. We can shrink it down, we can melt it down, but it's going to take this much time. Okay. If you do not have any issues, unexplained infertility. Okay. So 70% of the cases can also come with unexplained. Everything is normal. All panels, all they do you might be knowing that they do a torch panel, doctors, right? That is also normal. There's no infection, there's no PID, there is nothing. The tubes are open, the cysts are good, the ovaries are good. So this is called unexplained infertility. Okay. So in such cases also, we tell them that this is the average time that we are going to take. Let us work. We are going to work on the quality of the eggs and the system, and this is how we. You will, as an homeopath, also you will have to guide your patient. These are the days which you are most fertile. Please try to stay together. You have to instruct them. Okay. We cannot be just giving medicines and then come again next month. They feel it is not working. Either you lose your patient midway of the treatment, or they are like कि इसको कुछ पता नहीं है, क्योंकि वो ऐसी दुनिया में से आ रहे हैं ना जिसमें उनको सारे 2+2=4 ऐसा ही सिखाया गया है. अगर देखोगे गिन सकते हो वही सच है.
True. Ma'am, have you experienced any case where wife is not requiring treatment but husband does, or vice versa?
Okay, so you won't believe what I'm going to say, but what I see nowadays is this, that so many cases are there wherein only husband needs medicine. Only, I would put it on only. Okay. I do not know why this has been arising or it is on rise. What are the causes? Why it is at so much peak? Okay. There are various conditions wherein husband requires medicine. It is not just the number of sperms. Always remember. Okay. It is the quality of sperms that matters. Either way, we just need one good sperm vessel to make this whole process fall in place, right? But so many times that one sperm is also not enough, like it is not of the good quality. Either the count is less, which we call it as oligospermia, either the motility is less, right? Either motility and count both are less, it is called asthenozoospermia. And in 70% of the male cases nowadays, what I see is this, that they are azoospermic, 70% azoospermic. It is the most difficult of the homeopathic cases that we see. They don't have any symptoms. They don't have any history to give. There's nothing wrong gone in their life where you can find out something and you can take it as a cause, or you can take it as a symptom to prescribe on. Okay. So azoospermia is something wherein it is a big social stigma for the couple. When I meet them, they tell me literally, we have not disclosed it to our parents. We have not told it to our house. In-laws would pressurize the female, keep on, because there's no such mindset yet over here that we see that either way could be the issue. The female is blamed and blamed for years and years. But the thing is this, that our society is not acceptable into those areas. So we have to make them, though they come to us, because in this area, conventional medicines do not have anything to give, anything. They will give you HCG injections. They will give you follicle stimulators in a way that can increase their production. That does not work. Even in cases like varicocele, these are obstructive azoospermic cases, varicocele, hydrocele. So in such cases, there is no requirement of any kind of surgery. Homeopathy alone can help it very nicely.
Very true. Uh, what I have seen in my practice, treatment comes later. I have seen so many male taking semen analysis examination as a part of their ego. I mean, I have seen them not even willing to get their semen analysis done. I'm not lying. I've seen this in my clinical experience. So, my approach is, whenever I start, a fresh infertility or a primary infertility case, before even getting an ovulation monitoring done of a female, or a hormonal profile, a panel done, or anything, I ask the male partner to get the semen analysis done first. So once we are clear with that, we start with the female part. And I have seen that I have lost lot many patients, as if I have questioned over their potency or their competency, or or I have
Their
heard their fragility.
existence, their
Yeah,
existence in totality.
yeah. They might see me as a feminist, or too feminist consultant, who is as if targeting males deliberately, but which is not correct actually. See, for males, it is, you just get your semen analysis done, and if it is normal, then at least we can focus on one vision, right? I have seen males these days, this teratozoospermia is very common. I'm seeing these days, and I have treated lot many couples with teratozoospermia by just giving weekly doses of X-ray 200 to male, and just a few health supplements to female. That's it. Nothing else is required. And yes, the lifestyle modification, I mean, no bargaining on that. I mean, so
Yes,
lifestyle
very
modification is must
important.
for the couple. Yeah.
Very
So,
important.
yeah. So When we start practicing of infertility cases, we see variable kind of people, and that what make them individually different. So I would request that don't take it personally, be it a female consultant or a male consultant. It is just part of a treatment. Even being a homeopath, we need a correct diagnosis to treat you. We can plan your diet, we can plan your lifestyle, your do's and don'ts, things you need to take care of while just, for example, I have a case of female infertility, and she was having a huge complex cyst in oval.
Hmm.
So once we start the treatment, we told the female not to lift heavy objects, else she will end up into ovarian torsion,
Torsion.
and which might lead to surgical consequences. So we came to this do's and don't once we diagnosed it, right? It is as that simple. But at times it becomes very difficult to convince the patients that what your doctor is saying is absolutely right. Go with it. You won't believe one of my patient, a few of my patients, right? They will say they won't go to a center and give the the semen sample. They are very uncomfortable giving semen sample at diagnostic center, and they requested me, can they give semen sample at home? You should know that the liquefaction time of the sample is just 30 minutes. And in a city like Pune, where traffic is everywhere, in 30 minutes or after 40 minutes, even if your sample will reach, what will
It is
happen,
of no
happen to the
use.
sample in the report? They don't understand, and they still request me. I can pay extra, doctor, to the diagnostic center. Ask them to collect from my home. And even after explaining them everything properly, that this will affect your reports, the treatment, but still they're okay. It's okay. थोड़ा बहुत it's okay, ऊपर नीचे कर लेंगे. But they're adamant, they're very rigid to change and listen to doctor. Moving forward, just I spoke about that it becomes ego issues at times to the couple. What is the most common social taboos you have seen related to infertility or you have faced in your practice? Let's talk about them and bust them.
So one of the very weirdest one I have encountered is this that doctor, we cannot stay together in these days. Actually, now I'm fasting. Actually, now this day we have this. Actually, these days we have this. So at times I see that females, this is a little complicated. Okay, they are not ready for the child. They are being sent to the doctors forcefully. Okay. You might not see this very commonly in small cities, but in metro cities, female with good, like they also have their own personal timings, their own personal requirements per se. It goes both the way, but more with female. Okay. On the other side, I see that males are not ready to take responsibilities, but they are like, हाँ, इसमें तो मेरा क्या role है? Okay. So these are the taboos that they will not tell you on the front. You encounter it, you experience it, and you understand it over a period of time when you're talking with that patient. That अच्छा अभी ये excuse कर रही है. Second thing is that most of the times I see that in-laws accompany the couple. So ऐसे situation में अगर आप request करो तो भी the mother-in-law will say, no, I'll stay inside. How is the lady going to give
Fair.
some? Yes. So अगर हम बोले पेशेंट को कि आप उनको बोलिए तो then she will also be like, नहीं बैठने दो ना. Okay. So the in-law is like, नहीं हम हमारे में तो जाते ही है, हमारे में तो जाते ही है, साथ में इसमें क्या है, आप सब सब जो है सब सामने ही
बता
है, आप बोलो ना कोई बात नहीं, हाँ आप बोलो ना कोई बात नहीं. So it is not me who has to speak, it is she who has to open up. Okay. So these are very small things. Likewise, I told you some religious aspects. They are taking some unauthorized medications from someone. So उन्होंने बोला है कि इस दिन नहीं रहना साथ में. उन्होंने बोला इस अमावस्या को इसको ये. So how is this thing that going to go forward? Some medicines which they also don't know what they are taking, but that is something, it has come down from someone, and they told that you do this. Very very interesting, I'll tell you. I had one patient, she was from Gurgaon. Okay. So she particularly had tubal blockages. Okay. She was taking homeopathic medicines. It was some time. I mean, I suppose it was 3 months. ठीक है. उसमें क्या है, आपकी दवाई मैंने क्यों चालू की आपको पता है? She told me like that. I said क्यों चालू की? मेरी जो देरानी है ना, उसको प्रेगनेंसी है, पर उसको भी ट्यूब ब्लॉक था. उसने कुछ पुड़िया खाई थी दवाई का, ठीक है, पर अभी वो प्रेग्नेंट है. तो मैंने मांगी उससे वो दवाई की मुझे देते. तो वो बोलती कि नहीं, मेरा बच्चा आएगा उसके बाद ही मैं तुमको दवाई दूंगी. वो दवाई लूंगी ना तो मेरे को दूसरे महीने ही रह जाएगा, पर अभी क्या है, वो प्रेग्नेंट है, तो उस टाइम के लिए अभी मेरे पास कुछ करने को नहीं है, तो आपका दवाई चालू. She was convinced, okay, she was very much convinced that those medicines are only going to work for me, right? And it happened so. The day that lady delivered, okay, the day that lady delivered, and she took this medicines, my medicines were still going on, and the next one she conceived. So now that had become like she was more confident about that thing. अच्छा उसी ने काम किया है.
Ma'am, how, please share some experiences when you deal with the females age group more than 35 years, when we talk about precious pregnancy, or when the female has crossed 35
Yes,
years
yes,
of age. So please share some experiences.
yes. There are various types. Okay. Very primarily would be primary infertility, and if it is 35, 40 plus, there could be secondary also. Okay. That the females are wanting to have kids, the second child, or rarely I have also encountered patients who ask me for a particular gender. That is not possible. So these are other difficulties that we have to answer. And okay, so when it comes to 35 plus, or I would say nearing their 40s, they have their menstrual cycles are short. This is a very common trait that I have seen. Obviously, they would be having low AMH. Other most difficult thing that we see here is the thin endometrial lining,
Yes.
right? They they are continuously in a fear. Remember, they are continuously in a fear. अगले महीने पीरियड आएगा कि नहीं आएगा. अगर पीरियड नहीं आया, they are not happy. Trust me, they are not happy because they want the period to come on time. They feel constant agitation, constant hopelessness you see into them. You cannot even pacify them because you know that this is a natural thing and I cannot go beyond my natural conceiving abilities. A homeopathic doctor cannot work against the physiology. We can support the system, we can boost the system, we can harmonize the system, we can provide a little of covering from the external troubles. But if the system is slowing down, if the metabolism is slowing down, I can push it longer, but I cannot give it a lifelong surviving. So this thing is very difficult. These are the primary things, because when a patient is above 35 or 40, I have patients who are 40, 42, 45 also. Okay. And they are trying. They are, likewise, I told you, have come from various many treatments. The highest record patient I had was from 7 IVFs. And that lady at the age of 36, she had conceived with homeopathy. Right. So you see the work we have to do. Overall, it is not just conceiving and pregnancy being positive. It is a constant risk throughout their trimester, like first, second, third. They have low-lying placentas. They have hemorrhagic tendencies. They have,
Cervical
yes,
incompetencies. Yeah.
yes. The os is not closed properly. The length of os is less, right? Or they become they can go into preeclampsia. Sugar levels can fluctuate. Okay. But everything of this is manageable nicely with homeopathy if you trust your doctor. But yes, I have seen that if the patient gets conceived with homeopathy, they will continue till 9 months out of fear or with trust, I don't know, but they do continue. They do continue, and the results are marvelous. Marvelous.
Before we come to end of the session, do you like to share some cases or some experience of yours? Few cases, short cases.
Okay, would you like? I would just, yes, the recent one, she just delivered few days back. I would share that. Okay. So, lady, she was from Guwahati, Assam, and she is 35 plus, nearing her 37, 38, 38 exactly. Okay. She had two female child already. She came to me. She had 6 to 7 miscarriages before she met me. Okay. She had done multiple IUIs, multiple IVFs, everything was done. No symptoms. Very good lady, jolly, fine, hale and hearty. So I asked her during the history, why do you want third child? You have suffered so many times. Okay. One of her miscarriage was on 7th month. Okay. They said, still you're trying. What gives you that capacity and why do you want? Is it something that you want a male child? I asked very point blank. So she told no. Because I asked this question because you never know whether she aborted or she miscarried. She told me that she miscarried, but I had to ask this. Okay. So is it because that every time you're getting a girl child and then you get variety of patients? It is not necessary because I don't do that work. So I ask. I say whatever will come, you will have to accept it either way. And if you are ready, then only we can proceed. So she told me, no, I want that child which she delivered in the 7th month, who died, the child which she miscarried in the 7th. I want that child back. So at all cost, I want that child back. She told me this. Okay. So then we begin with the treatment. Okay. And later on, with her multiple reports she had done, there were no symptoms, but her torch was positive. Okay. So now, when you see the torch profile, you see rubella, you see like all the other categories. So her rubella was constantly coming positive. Okay. Now, there are two categories over here, IgG and IgM. So when your IgM is positive, it means that the infection is ongoing. It is an active infection. And when your IgG is positive, it means that it has already passed and the antibodies are present. Right? In her case, obviously the IgG was only positive, but she would still have the symptoms. I mean to say, little not very flown up, but we can see that these are the symptoms which are related to rubella. Okay. IgG was very strongly positive. It was not mild, it was very strongly positive. Okay. So this was something I had taken into consideration that we can take as a general PID. Okay. Pelvic inflammatory disease. Or we can just see if she has other symptoms like skin rashes, fever, cough, constant cough, nagging cough, etc. etc. Okay. Urinary tract infection, etc. So this was her first symptom. Later on, talking with the patient, discovering things, she told that I have a feeling, okay, I have a feeling that if I conceive now, that child will come back to me. So you use all these rubrics. You use the menstrual pattern. You use the miscarriage. I found out on which months all your miscarriages were on. So we take into consideration these things. We give medicines accordingly. We give miasmatic medicines to remove the blockages so that this trouble does not reoccur to her. Even after taking aspirin, this is what doctors start immediately if you conceive at 35 plus. They will immediately start your aspirin. So even after doing all those things, she used to miscarry. Okay. And you won't believe, to my surprise, a single dose of sepia cured her. She became pregnant just in the second month of the treatment, and she delivered a very healthy baby just few days back. Even throughout her pregnancy, there were ups and downs, and a lot of you can say, the work we pour in, and we are also at edge, right? We also feel, "Arey, kya hoga," because there is a history, and every time you feel like, even though you are confident, but such cases, like, you feel like, let me see how, like, her low-lying placenta also we pushed up. It happened with just few doses of homeopathic medicine. It worked. It just
True.
went up. Her delivery, she told me that if possible, I would like to have a natural delivery. We tried for that as well. So it is not, and yes, I just forgot to tell you, she had an AMH of 0.02. So even after that, she conceived naturally with homeopathy. So it is not something just like कि लगा तो तुक्का. ऐसा नहीं है. The system has the capacity. If your patient follows everything, I do give good lifestyle habits, good tips, food habits, a small prescription like go hand in hand with your husband, try, for the garden, harmonize your relationship, make it a balance, leave your regrets behind. Try, I mean to say, because with females it's very overpowering. And even those stigmas and those troubles will not allow her to conceive.
So it was a wonderful, insightful session indeed. And for this session, I would like to thank Dr. Vanshlunia, my
Yeah,
very close friend. Yeah, he was the one who pushed, I guess, both of us for this session, and he very well succeeded in this. Thank you, Dr. Vansh, if you are listening this session, for having, variable, potent speakers, I must say, and going deep down to the sea and getting the pearls out for interviewing them, really, and for your friend's show is, something which is very commendable, and I owe this to you. Thank you so much, and thank you so much, ma'am. It was a wonderful session. You've been amazing, and we are so blessed to have you, and it was very
I
insightful.
should thank you to give me this opportunity. Right?
And we'll look forward to have more sessions with you on other topic on your other forte, definitely
Sure,
in future.
sure.
We always take a promise from the speaker every time that you have to come again.
For sure, you're doing so good job. Like, I always look up to you. I have discussed so many times with Vansh as well that she's wonderful. I don't not I like I'm not very consistent, but I do watch all your stories, and I find you so gracious, so gracious.
Means a lot. Thank you so much, ma'am, and we'll look forward to have you. Thank you so much.
Thank you.
So I hope you all have enjoyed the session. Do not forget to write us in the next story box what you learned, what are your feedbacks. Next week, we'll be back with another guest. You have to hold tight. Soon, we'll be having a century of our episodes. And if you want any of your favorite teacher or pioneer to be listened, heard, interviewed in your Instagram live guest talk with Homeopathy Heals, I would request you to drop me their email address. Our team will send them email for the invitation for guest talk. And thank you so much for being such a patient listeners and wonderful audience. Till then, stay fit, stay healthy, homeopathy.